BPH, which stands for benign prostatic hyperplasia, essentially is the normal enlargement of the prostate that occurs with all men after the age of 40. And that enlargement can cause many symptoms that men experience, such as getting up to go to the bathroom at night, feeling that they have to go a lot, feeling these urges to go where they really got to go, or else they may leak urine a little bit. And it also can cause problems with a slow stream or feeling of not really being able to empty their bladder completely. Well, it can vary from man to man, but the most common symptoms tend to be a lot of men will complain about getting up to go to the bathroom at night. They'll also experience some symptoms when they urinate, such as they'll have a hard time getting going with their urine flow. They may start and stop, which we call hesitancy. They may also feel like they have a weak stream, or they may have to really push hard to urinate, or they'll urinate and then they'll feel like they'll have to urinate again, as well as feeling like they have to go a lot and feeling like they gotta go, or they may leak urine. It affects all men to a certain degree. Some men may have very few symptoms, and some men may have very severe symptoms. But all men all men after the age of 40 will experience a natural enlargement of their prostate, and it will. And it's hard to predict which men will have mild symptoms and which men will have severe symptoms. But BPH will affect pretty much all men if they reach a certain age in their lifetime. The treatment options can range from simple observation, behavioral type of treatments, such as drinking less fluid before you go to bed, or just accepting the fact you have to get up once a night to go to the bathroom. And then obviously, depending, with increasing severity of symptoms, you'll see increasing treatment options such as medications, and then we can get into things such as surgical therapy to reduce the size of the prostate. Well, there are a lot of benefits compared to the traditional monopolar transurethral resection of the prostate. With bipolar energy, you have less risk of certain side effects related to the treatment, such as a symptom that we call TUR syndrome, which means that if the fluid gets absorbed into your bloodstream, that can cause things such as stroke and seizures. What we've also are seeing is less blood loss, better visualization of the prostate during the procedure, and with those things, we're seeing basically the transfusion rate or blood transfusion rate to approach zero with the bipolar vaporization. Number one, the patient can more often than not, or 99% of the time, go home the same day. Sometimes they can go home without a catheter. There's essentially no need or 0% rate of transfusion, and the recovery is much quicker. The risks are, with any procedure, obviously there's risks related to anesthesia, which are very minimal in today's world. I think the certain risks that you'll see is, you have a risk of infection that, again, we usually handle very well by giving patients medication, antibiotics at the time of surgery and sometimes after surgery. The risk of bleeding is very minimal nowadays, but there is a risk of bleeding that's usually self-limited and certainly not life-threatening. Then you can have some degree of increase in your urinary symptoms immediately after the procedure that will dissipate over time. And then there's the risk that's associated with some of the medications, but certainly associated with this procedure, where you can get something called retrograde ejaculation, which means that when a man has sexual activity and reaches climax, that the fluid will go backward into the bladder rather than outward through the penis. Usually there's no special preparation other than not eating or drinking before surgery, and taking their medicines the morning of surgery in consultation with their primary care doctor or their cardiologist. But there's no special preparation needed for this procedure. Well, they should expect a excellent symptomatic response with very minimal degree of recovery needed. Sometimes patients will go home with a catheter, sometimes they won't. But usually patients, for example, if I do a procedure on Friday, they're back to work on Monday without a catheter. and their urinary symptoms are, usually immediately better. They can experience some degree of increased urgency and frequency related to the procedure that will get better over 4 to 6 weeks, and they'll have a very, superior symptomatic response. Well, they go home the day of surgery, and usually by a couple days, they're pretty much back to normal. The results are usually permanent. The retreatment rate is very low at 15 years, less than 20%. Usually they can go back to work within a couple days, and normal activities, they can go back to pretty much all their activities within 5 to 7 days. It does not affect sexual function in terms of ability to get and maintain an erection in any way. It doesn't make it better, it doesn't make it worse. The only thing they will notice is that after a button procedure, that they will have retrograde ejaculation, which in 80% of the men is permanent. It's usually, it's not an infectious risk, doesn't in any way impact enjoyment, satisfaction of the man and the partner. It's certainly an issue if someone's still trying to have a child, but usually in this patient population, pregnancy and child rearing is usually is no longer a concern.